My name is Cindy Warner, and I'm here from HQI, Health Quality Innovators. We're here today at Chickahominy Family Practice with Dr. Anoop Gokhale, primary care physician, and Dr. Michelle Thomas, pharmacist, who works within the practice. Today we would like to share how Dr. Gokhale and Michelle work together in a family care practice setting and how utilizing a pharmacist to assist the physician with chronic care management and other activities within the practice, how that has helped patients and how that has assisted the practice. So Dr. Gokhale, could you share?
Sure, thanks. I'm a board certified family physician in Virginia for about 30 years. Our practice is a rural practice between Richmond and Williamsburg. And after first few years of practice, we hired our first nurse practitioner and then our physician assistant. And since then, we have managed our practice as a team approach to patient care. And we grew very fast. And about 6 years ago, we outgrew the location we were in, so we moved into a new location. And around that time, Michelle approached us and told us what a PharmD can do for the practice and for the patient care. And we were not aware of what PharmD can do. So at that point, we worked with her to set up our diabetic education programs and patient care for diabetes management. And she started working with us for 2 times a week, but she got busy right away. And after about a year or so, she has been working full time with us. And at this point, she has improved the patient care for the practice. Diabetes management care has improved. And a few years later, Medicare came along with some new programs, annual wellness visit, chronic care management, and Michelle took a lead into developing those programs for our practice. And we brainstormed and formalized all those programs. And that has helped the practice and the patient care tremendously. And in fact, our outcomes have improved to the point where we had a huge bonus from a commercial insurance last year. And we hope to get more bonuses from different insurances and all that. So Michelle has been very instrumental in improving the practice and the patient care for the practice. So thanks, Michelle.
So for me, working with Chickahominy Family Practice has been a great opportunity because I think as a pharmacist coming in, I add a new element, a new perspective on things, and am able to help with developing the newer programs and helping with monitoring patients' medications, making sure they're taking what they should be taking, how they should be taking it. We have a collaborative practice agreement, and I'm able to help in particular with patients with diabetes to make sure they're on the appropriate medications and the appropriate doses. The chronic care management program has been particularly helpful with that because in between patient visits, I can help to assure that patients aren't just on the medications when they come to see us, but in between visits, they're handling things appropriately, they're checking their blood sugar, everything's running as it should, and if not, we make sure that they're back in or we make the changes that are needed so it doesn't wait.
Oh, I agree. In fact, patients love the call and the care so much that they miss it. Every month, Michelle or one of her associates call the patients, and when they come and see me every 3-4 months, they always appreciate the calls you make and your people make and how they are well taken care of. Patients have truly appreciated that.
Yeah, I think that patients like it, and also it seems to be a little bit of a savings of time for the physician because we make sure that if they need refills, we take care of that. They don't have to have that phone call. If they have self-care type questions, we can answer them without having to go back and pull the physician in every time. And also I think that we make sure patients get back in for their follow-up appointments that they might have otherwise pushed off. Follow up with their specialist as well, because a lot of times we'll refer them, but they don't actually follow through on that unless we really push them to make sure that happens. On the other end, making sure the information comes back to the physicians to let them know what happened with the specialist.
And our program has grown so much, the chronic care management part of it, that we had to temporarily, we have shut it down, enrolling new patients into the program because we cannot manage. We have to hire more people to manage the program. And patients, there is so much demand. Patients are asking for it. I just want to add one more thing, that financially we are a private practice. We are not associated with any hospitals or anything. So finances are a big thing. How can we afford someone like Michelle and nurse practitioners? But financially, it has been also good for the practice. Michelle joining us, and I'm sure she has paid herself multiple times over. But it has been a good patient care, and it has helped the whole team very much.
Oh, I think that's great. Well, this is wonderful news, and I think it's a wonderful opportunity, and I can't thank enough the both of you for taking the time today to share how you have both provided better care for your patients and also how a pharmacist can help support primary care practice in the outcomes that they're hoping to receive with their patients using chronic care management.